So, as I mentioned, this is an abbreviated version, but with some extra stuff jammed in there of a presentation I gave at the Veterinary Dental Forum in 2024 in Palm Springs. So, okay, let's get started. So we're looking for the opportunities in our practice. Before I start, if any of you have children in the house that find the chocolate and eat it, hide it in your vegetable drawer. They don't look there. We had this block of chocolate in here for at least 2 weeks and it stayed there intact for 2 weeks until my husband found it. So anyway, that's just a little bit of a life hack for you. If you're like me and you have to come up with inventive ways to hide chocolate from your children, because we know it's bad for them, right? Okay, hidden revenue. It's a problem in practice. Majority of practices and of equine practices are not that profitable. It averages around 10% for bricks and mortar practices and can go higher, 15% for ambulatory practices. However, some really well-run equine practices can approach 50 to even 60%. I used to have a practice when I had a general equine practice that was approaching that, but that didn't happen by accident. I went and got the education and had the support to implement that. So today is going to be a little bit of business and a little bit about dentistry, and we're going to bring those together to help make your practice better. I do appreciate that not everybody on here is going to be, we're going to have a real mix. We're going to have some associates, we are going to have some practice owners. I do appreciate that if you're an associate, you will have less control over some of the things we're going to talk about. However, as an employer, if one of my associates came to me and said, hey, I want to do this for my dentistry and this is what we could do, these are the steps and this is the potential result, I would be 100% backing you on that. And I love it when the vets I employ come to me with those sort of things rather than just coming to me with problems all the time. So if you can be proactive about that, you definitely get a gold star rating as an associate. So hidden revenue practice in your revenue problem in your practice. If you are an equine practice, you will, or a mixed practice, you are already going to have equine clients in your practice, right? How many of those are you doing dentistry on? How many are not getting dentistry done either not by your practice or not at all? So they're some of the ones that we can very much focus on. Most of the vets really underutilize these opportunities. They will kind of track how many new clients they get and how many dental numbers they're doing and give themselves a nice pat on the back when that is steadily increasing. But what about we're looking for the low-hanging fruit here. What are the things that are easy to do in practice? They're not going to take too many brain cells to do. They're not going to take a huge amount of time or a huge amount of effort, but they will take some focus. The result of not paying attention to these is lost revenue, so lost income for your practice, which then has a flow-on effect. It means there's less cash available for buying oroscopes, for example, for getting the newest x-ray machine, for making sure that all the vets in the practice are totally kitted out with all the equipment that they need. It does mean missed care for our patients. I'll say it again, we became veterinarians to help the animals that, for most of us, that's what we were born, we were put on earth to do. And if we are missing their care in dentistry, then that is an animal welfare problem. So this is a utilization problem, not a marketing problem. I am not going to advise you guys to go out and spend money on ads and try and get new clients and things like that. We're going to look at what we've got inside our own practice first. So where does the gold already exist? Are you doing oral exams on every case that you sedate? Say you've got and look, I'm not going to be specifically talking about dental only practices today because you're really doing dental exams on every consult, right? But this is more for the general equine practices and mixed practices. And this does apply in many cases to your small animal exams as well. For example, if you are interested in dentistry, you are going out to do a bandage change or a recheck, whatever it is. If that consultation requires sedation, that is a golden opportunity for you to ask permission for the owner, can you do an oral exam? So if you're just starting out, it would be something like, I'm really interested in dentistry, I'm passionate about it, I want to get exposure to more cases, and I'm taking the opportunity to look at as many mouths as I can. Would it be okay while Daisy is already sedated? Can I have a look in her mouth? It's rare that a client will say no. They almost always say yes. They do want to help you and support you in your endeavors. The really good thing about that is you can identify pathology in many cases that you can then help them with. The other thing is that the client goes, wow, they are actually interested in this, because a lot of clients think that vets hate dentistry, and it's because a lot of vets do hate dentistry. And it's also, they've been educated that by the lay dentist rhetoric, right? That vets aren't doing dentistry because they're too busy doing emergency cases. Your lameness exams. Are you doing oral exams on your lameness exams? I wouldn't recommend offering oral exams when it's an emergency. So don't offer an oral exam on a colic. Don't offer an oral exam on a mare with dystocia. I mean, just be reasonable. Keep your wits about you for this. Where it's appropriate, do that. And you might need to build in 10 minutes to 10 minutes to just make sure you've got enough time. Gina, what do you like to use to provide the best sedation for oral exam? I have an entire separate presentation on sedation, using sedation for dental and head surgery procedures. It is an ebook inside of our paid members program, which, Gina, I think you're a part of that, so you'll be able to access that. But in a nutshell, my sort of go-to cocktail is acepromazine, ditomidine, and butorphanol. When I was in general equine practice, I had the luxury of having porta-safe stocks, so a portable set of stocks everywhere I went, so I could very easily and safely use a higher dose of sedation, which meant that I was faster. The horses were more secure, and I felt more secure knowing that they weren't about to fall on me. And I could use so I could use a bigger dose, be more thorough, be quicker, and have less resistance to any, causing less pain if I was, for example, cleaning a period pocket that was painful. Older horses, I reduce the acepromazine, but I really do love ACE as an additive into that. I rarely use any diazepam or midazolam. I kind of keep those for horses that have refractory tongue movement that is just getting in the way, but that's kind of just my standard there. Poor performance cases, it's a good idea to do an oral exam with those. Of course, any weight loss or behavior issues. Tommy's saying, would you charge for this? I wouldn't. If you are saying, in the illustration that I gave, when you're asking the owner if you can do the oral exam because you're interested, don't charge for that. But make that as part of your physical examination. You will get a lot of resistance if you say you want to do something because you're interested, but then the client gets a bill for it. That's going to leave a pretty bad taste in their mouth. If using the oroscope, and I'm not saying you've got to use the stocks to do the oral exam. You can do an oral exam without stocks. It is, of course, a little bit harder. An oroscope, I don't charge for using an oroscope. It's one of those things that, yes, you definitely could. I'd prefer, and we'll talk about this later on, I'd prefer actually just having that bundled into my dentistry charge. And I'm a big advocate, if that you are good at what you're doing, we need to be charging appropriate prices. So we'll be talking about that in a minute. Mandy's saying, I have a basic fee, then additional charges for the out of ordinary work, caudal hooks, step molars, etc. Show this to them for correction and they don't complain. Yep, I agree. Show the owner, this needs treatment. We can do this for you today. It will be X dollars. Are you ready for me to go ahead? They say yes. Okay. Where else does the gold already exist in our practices? So lost and lapsed clients. How many people have you seen once that never come back to you? Sometimes that's for good reason. Sometimes they're jerks and you don't want them in their practice. Sometimes they didn't have a good experience. Sometimes they might want to find somebody who, I'm going to admit, some clients want really, really cheap service. Some clients want the best service. Are your clients only trying you once and leaving because they want what you're not giving them already? And I'm not saying cater to the catered to the price shoppers. They're your C-class clients. They bring in minimal revenue and they're maximum headache. So they're part of the 80/20 thing. So lost and lapsed clients is a big opportunity. People get busy. Life is busy. You know, there is work, there is community, there's often children, grandparents, people of my age. I have heard us referred to as the sandwich generation, dealing with aging parents and raising kids at the same time. So everybody, you know, you might have babies, you might not have any children, you might be in an entirely different situation, but in general, life is really, really, really busy. People forget things, so don't be afraid to keep reminding them. Finding out what your clients want. This is a really interesting one. When I had my equine practice, we went through, with the help of some business coaching, I went through an exercise to actually go in and find out what our clients wanted. And we got a heap of clients together from all, you know, A class down to C class to non-clients to, you know, other stakeholders in the community. And we took them out for a meal one evening, and we had an external facilitator run this for us to actually find out what they wanted. And here was I thinking, you know, we are really good at dentistry. We're a full service equine hospital. Well, we didn't have a theatre, so we're not that full service. You know, they want the expert dentistry. They want, you know, the friendly service. No, the number one thing they wanted was access to a veterinarian in an emergency. And that's day or night. That's not just night. And I was like, damn, you know, we try really hard on this. But what they really want is access to us when they need it, or when they think they needed it. So that actually became an opportunity to educate our clients, to help them to understand that we are more than just emergency vets. Your existing A-class clients, how many clients do you have? And you're instantly going to know. You can name the top 5 in your head. Who are your A-class clients? You love working for them. They pay their bill on time. They listen to what you say. They follow instructions, and they're just really pleasant to be around. How many of those A-class clients do you have in your practice? Imagine if your practice was made up of entirely of A-class clients. That would be freaking awesome, right? In reality, I don't think that's realistic, but there's certainly practices out there that deliberately weed out their C-class clients and make a big effort to increase their A-class clients. So a good way to talk about this is to say to your A-class clients, I really enjoy working with you. I love coming to visit your property. I love that you take such good care of your horses. So you're actually already complimenting them, which makes them feel good. And then the next line will be, who else do you know that takes care of their horses as well as you do that you think could benefit from our services? Give them a minute to think about it. And then you ask them for referral. Could you contact 3 of them and let them know? I'd really appreciate that. Something like that. You can offer, like, we used to also do gift cards for referrals. So when we would give them, we'd go online and get, you know, those little credit card size gift cards, same as you can get for iTunes and things like that. We made some of those, and we would actually give them to our A-class clients, and we'd write our A-class clients' names on there as a referral, and we would ask them to give them to their friends. And when their friends use them, they would book a consult and use it to reduce their fees. Then the A-class client also got something in return. So we kind of didn't really. Let me think about it. Actually, it might have been some money off a consultation, but more frequently what we would do is things like send them, you know, the scratchy lottery cards. We'd send them a handwritten thank you card with a scratchy in it. They loved that. Nobody gets handwritten cards anymore. You know, it's all emails. Merry Christmas, here's your email. We also used to give them a case of wine at Christmas time. I do that now for our top referring practices, is that they get delivered a case of wine. Nice if you can drop it in person. For me, that's not realistic. So we get it delivered. Anyway, getting off track. Get rid of your C-class clients. Don't service them. They're a total headache. You are suddenly not available. These are the people that only want you at 10 p.m. on a Sunday night when the horses are dying of colic that you've seen. that they've been watching for the last 2 days. And I know that is really difficult from an animal welfare point of view. You can educate your C-class clients to become B-class clients, even A-class clients occasionally, more likely a B-class client. Get rid of them. They can be somebody else's problem. They can go to another veterinarian. Life is too short. Okay. Practicing better quality medicine. Pretty much everything that I'm going to be talking about today is all about educating your owners. Educated owners understand and they say yes. So things that we can talk about, bundling our services, and I'm going to go pretty quickly here because there's a lot to cover. Bundling our services, for example, wellness packages, etc. What sort of add-ons? What are you currently doing that you're giving away for free? What add-ons can you offer there? Sheath cleaning for geldings, fecal egg counts, etc. Podiatry radiographs, PPID screening. We talked yesterday about doing age-based survey radiographs of incisors and canine teeth for EOTRH. So any horse that's over about 17, sorry, recommend to take some incisor and canine radiographs around about every 2 years, more if you find something and you want to track it. So it's your diagnostics, it's your imaging, it's your blood work, and educating owners that good quality medicine costs money. But in the long run, if they are spending money on preventative healthcare, it does, in the majority of cases, prevent those big disasters that can end up costing them way more. And I touched on it yesterday. The horses that we see regularly for dentistry end up having far less disease and need far less extractions over their lifetime. So, dentistry is really important, but I know I'm preaching to the converted here. Encouraging insurance. This is an interesting one. It's huge in the UK. It's not really a thing in Australia, and I think it's getting there in the US. What we are not talking about is we are not talking about cutting corners to save costs. We are not, absolutely not talking about over-servicing. Don't over-service your clients. They hate it. It makes you feel icky. Yuck, don't go there. Don't forget to educate them. Every touch point is a chance to educate. Oh, there's my carrot chocolate photo again. The missed moment. Often this is kind of like while you're here. Can you take a quick look at this? When you are talking about anything to do with the mouth, there is no such thing as a quick look. You will, if you're not doing a proper sedated oral exam, sedation, clean mouth, speculum, mirror, good visualization, etc., you will miss stuff. And because as veterinarians, we are documenting our clinical findings. If you miss stuff, you are potentially liable somewhere down the line if it turns ugly and then the owners decide to go after you. So don't be tempted to skip corners. You either do a proper exam or you don't do the exam. This particularly applies for pre-purchase examinations. I can't tell you the number of cases that I've been involved in that I've been sought as a expert opinion for veterinarians getting sued over pre-purchase exams, and they've ticked the box, they've done an oral exam and they've missed stuff. Either that's because they're not educated or they didn't look. I don't know. I do suspect that a lot of the time they're only doing a digital exam by feeling only, and they're probably not sedated and they're probably not using a light in a mirror. So every time speculum and a full oral examination, you are identifying the pathology and showing your clients. Most clients are really interested in this because they've never seen inside of a mouth before, or very rarely. The most common thing they're going to say is, well, look how big the tongue is, or look how far back it goes. It's funny. It's still funny every time I hear that. And then this is about recommending the next steps clearly. Okay, this is one of the things for your workbook. What are you currently giving away in your practice for free? Is it sheath cleans? Is it the things that Randy was talking about? Reducing those caudal hooks, those rostral hooks, cleaning out those perio pockets, etc. Clients do not decline services or workups because of the price. They decline it because they don't really understand what you're talking about. They don't understand how important it is. It may be because the way you are wording it, that makes them feel that you actually don't feel it's that important. So that's the difference between, oh, this horse, there's a fracture here. We could X-ray it, we could X-ray it in 6 months, or we could just see how it goes. When you frame your advice like that, the client's going, they don't really think that the horse needs it, so they will decline. And if you do think that the horse needs it, it would be framed as, we have identified a fracture here. There is or there isn't pulp exposure. The gold standard to the diagnostics to find out what's going on, because we don't have X-ray vision, is to take an X-ray and assess what is happening inside the horse's head. We can see it. We can see it here, and then they will understand that not only will they understand what the process is, but you go through about this is important because dental disease, it can be very, very painful. It can spread, and earlier treatment will save you money in the long run. And then if it's normal, great, we can be reassured that everything's okay, and happy days. So showing your clients rather than telling you, pictures speak 1,000 words. That's where the horoscope really does come into its own. So as I said, Tommy, I don't charge for an horoscope, but in fairness, in my practice now, I'm doing a lot of horoscopy during surgery, so surgery assisted. So it's just part of the price. But I feel that horoscopes will actually pay for themselves, because you can perform better diagnostics. You can see things that we never used to previously easily be able to see, and that's where they pay for themselves. But I'm also not against charging for it either. Educated clients say yes. You guys all know that. Okay. Every consultation is a chance to educate. So there's another thing in your workbook about what are the different ways that you can educate your clients. Every single consultation. That is easy. It's cheap. It's so cheap. It's free. If your clients or your owners are there during the dentistry, educate them. Get them to feel before and after. Make sure they're holding on to the speculum. Make sure they're putting their thumb inside, because most of them will put their hand in with their thumb up. Make sure the speculum's on properly. It's not going to slip off and trap their arm. Show them what you're seeing in the mouth. Much easier with something like a speculum light compared to a headlight. Sometimes you've got to take your headlight off and put it on. Offer to take a photo of them doing an oral exam. They love this. It will be up on their Facebook profile page before you even drive out the gate. I can guarantee you. They just love it, because it's something really novel for them, and they love their horses, and they want to show their friends that they're educated and they're loving on their horses by providing them good dental services. Client education nights. This is one of the easiest things you can do that will give you the biggest bang for your buck if you want to increase dentistry in your practice. So this is about getting offering. We used to run it at the local pub. It would be a gold coin entry. The gold coins we collected will be donated to the charity that we did a lot of work for, which is Heavy Horse Heaven. So the money would go to them. Heavy Horse Heaven would be there on the night. They would be helping us with, checking names off lists and things like that. The clients would come and buy a meal at the pub, have a couple of glasses of wine, and we would give presentations. So if you're doing a presentation on dentistry, make sure you're presenting something else as well. You won't get a great uptake if you're only presenting dentistry. As much as we love it, the clients don't necessarily love it. So it could be something like first aid, or lameness, or parasite control, or any breeding, anything that you can think of there. Social media is another great opportunity. So posting photos, educating your clients, running quizzes, etc. There are so many different opportunities here and what you could do. One of the things that's becoming more prevalent now is doing Facebook Lives while you're with a patient and actually showing them. An example of this is the crew from Equine Dental Clinic in the UK. They do this really, really, really well. That they will often get on, take videos or do Facebook Lives and show you what they're doing. And that gets, it's a great opportunity to educate your clients and gives them a lot of reach as well. So what's that, Tommy? The WDE scope, you have a QR code to the app that you carry with you. The owner watches and downloads to their phone. Wow, what a great idea. I haven't thought about that. That's a really cool idea. Just Luckily, it doesn't record audio, right? It only records the image, so you can't record what you're saying. That's a great idea. Oh, so I've talked about it a few times here. The online dentistry course that we offer with the Equine Practice Company is closed usually. However, this week we do have it open. Somebody has already found that link and has already joined from in this group. So great big welcome to you, and hope you're jumping in it already. What we decided to do, and this is one of the extra things that we put in just this morning, is we're going to give you some extra resources, because in the platinum version of our dentistry program, we already give you a done for you client education. It's both in PowerPoint and Keynote, where you just drop in your clinic name, your clinic logo, your names, and a photo. And that's all you have to do. And it's just ready to go, client appropriate. We also decided to give you another presentation, which is not in there, which is a done for you client education PowerPoint on first aid. Again, client level appropriate. All you need to do is put in your name, your clinic logo. I'd recommend a photo of you or your team, and it's there ready to go. That's going to save you at least 20 hours of work. With dentistry, and this is what we say for the people joining our program, is that you're going to spend money on your education, right? It shouldn't be a cost. It really needs to be an investment, and you need to get a return on your investment. So one of the best things and the easiest things, and something you can do that's going to give you the fastest return, is to set up a client education night. We're already giving you the resources for that, and invite all your clients, and you'll get some new clients out of it. Educate your clients on dentistry, educate your clients on something else like first aid. Take bookings on the night. I can't tell you the number of times that I've had the people going through this course come back to me and said, I've paid for the entire course this month, just with the new bookings that we've got and the pathology that we're finding, etc. So it is a really great way to get a very quick return on your investment if you are investing in yourself and your education. We've also thrown in there, and my team actually doesn't know about this because I really only did it this morning while I was sitting here having breakfast, is also going to throw in the proven marketing strategies for veterinary equine dentistry, which goes a bit deeper into the stuff that I'm talking about today. And we are also going to give you a 12-pack of done for you social media images. So they're Instagram and Facebook ready. Just brand it with your logo, away you go. And then something we haven't offered before is that we're almost done. We're putting together, we're not almost done actually. In my head it's almost done, but I've got the syllabus for you, is the 12 months worth of client education newsletters. So these are client appropriate newsletters, information sessions, etc., that you can email out to your clients as touch points throughout the year, especially on dental month. And you will just be then kept top of mind the entire year. And especially for the lost and lapsed clients who are like, oh, that's right, my horse's dental is overdue, I'll book in. New clients, or people could send it on to their friends. You'll get new bookings from that. So that's another great resource for you guys there. And if you're already a member of the dentistry course, I know there's a heap of you in here. Don't worry, you're going to get this as well. We don't believe in only doing good deals for new customers. We're not a bank. So you'll be getting that as well if you're already part of our community. Okay, so how are you guys feeling? Are you getting value from this already today? If you just want to post in there, what has been your key takeaway so far? And I'm going to take an opportunity to have some coffee. Okay, while you're writing those, I'm going to keep going. Okay, 3 ways to grow a practice. One is to increase your number of clients, which takes more work. Second is to increase your frequency of visits, which also takes more work. Most veterinarians are already overstretched as they are, so these are the things that I would advise doing kind of second and third. And the last one, I think the most important one, is increasing your average transaction value. So if you haven't heard that term before, average transaction value, ATV, it is the average value of an invoice that you're writing over a set period. It is a great KPI or key performance indicator. thing to track over the lifetime of your practice to see that are you consistently providing good value for your clients reflected in the average transaction value? Is it going up? Is it going down? It's going to give you an idea if there's a problem in your practice well before you visit your accountant once a year and they give you the bad news. You know what I mean, right? Yeah, awesome. The good thing about dentistry is this can improve all three. This is a photo here. This is up in far north Queensland, just near Townsville. Let me see, zoom in. So you remember I was, no, actually it was a different group I was talking to about. So I'm doing sinus surgery on this horse. And I've got the adhesive iodine impregnated drapes just there. Okay, so a simple conversion framework for this. You need to look properly. You need to do, the proper exam that we've talked about ad nauseum here, finding your pathology, showing the client, recommending this clearly, and make it easy for them to say yes. I've only just very briefly touched on that conversation. Things that we're talking about here. I know that there's some of you in the group that are doing our business mastermind thing. Some of you have been in it for 4 years now. Some are just new last year, and we're opening it up again at the end of this year. But we spend entire sessions on this, how to get clients to ethically say yes. It's absolutely a game changer. Excuse me. Okay, increasing our fees. Hey Sylvia, I'm so glad that you're here. Nice to hear from you. Importance of phrasing options and recommendations a certain way to make it happen. Yeah, for sure. Betty, awesome, very relevant, simple. You are so right. This is not rocket science. We just don't think about it because we're so busy running around trying to do everything and fit everything into one day. And also remember to eat 5 servings of vegetables and drink 8 glasses of water and be there for our clients and our parents and our children and our community and get enough sleep and get 30 minutes, la la la. And the list goes on, right? Life's busy. It's just a matter of paying attention to it. Most people, this is Zanzi, one of my Rhodesian Ridgebacks. Isn't she gorgeous? She's a whole lot more grey now. She's getting a little bit arthritic. She's a whole lot slower now, but isn't she just the most gorgeous thing? She obviously wants food, which is why she's looking at me like this. They are definitely food motivated. People, veterinarians in particular, are really, really fearful of increasing their fees. They think that people will judge them. They think that their clients will think that they're greedy. They think that clients will leave, that they'll be judged. They won't be liked or trusted anymore. Clients will never call you again, and they're not good enough to actually being able to live up to that. So I want to change this mindset. It is an absolute scourge of the veterinary industry as a whole. You guys have seen it before, comparing the cost to a human ER visit, especially in the US, to a pet or a horse ER visit for anything emergency. The difference is just absolutely staggering, but it's our fault. We do have the opportunity to fix this though. Just because it's been like this in the past, it does not mean it has to stay like this. So are you charging appropriate fees? This is my girlfriend's daughter, Barrett. They are from Texas, and when they came out to visit, she must have been thinking maybe 8 or 9 there. She's now 15 and as tall as me. So that was a long time ago now. She's very, very cute. Kirsty, finding gold in existing clients and sorting through A to C clients. I love these concepts. I have a solid repro clientele and you are very quiet 5 to 6 months of the year. So been looking for something else to fill a void for a 30-year practitioner who wants to continue my career as long as I can. Love your approach. Yeah. Repro and dentistry fit so well into each other because you can do your dentistry in the off season. And if when you are doing, especially doing assisted reproduction, it is a great opportunity if you can fit it in to make sure their oral health is up to speed. There is a really strong link between oral pathology in people and low birth weight babies. I've actually given a presentation on this before at the Australian Veterinary Association conference in Adelaide maybe about 3 years ago, it was pointed out to me that by some of the repro specialists that humans and horses have different placental attachments, so it might not be, the direct correlation might not be as direct as I was thinking it was. However, it is definitely still a thing, and we do know that periodontal disease in particular does put out a constant stream of bacteria into the bloodstream. And if we're trying to get a mare pregnant or dealing with a pregnancy, we want to reduce the risk of them not getting pregnant. We want to reduce the risk of early fetal loss, placentitis, etc. So I think dentistry definitely has a role in that. Also has a role in feed conversion, right? We want the feed that we're feeding our horses to be actually utilised properly for them, instead of just passing through and whole grains and the manure and all that sort of stuff. So yeah, Kirsty, repro and dentistry, they fit so nicely in with each other, as does chiropractic, acupuncture and alternative therapies work that also fits in really, really well. Okay, let's go back to fees. I'm just going to have a sip of water. Right, we've been going for 45 minutes, so we might try and speed it up a little bit. Remember, I only want you to take away about 10% of what I talk about today, because there is literally so much. And this honestly could be a 3-day seminar with everything here, probably even longer, right? There is so much in here. So majority of practices undercharge because they fear that that people will think they're greedy. The most common things that vets will do is they'll just charge what the going rate is or what Joe Blogs down the road charges, and they might go a little bit above that or they might go a little bit below that. New clinics especially tend to want to undercut to try and get all the clients, but you absolutely shooting yourself in the foot doing that. We really want the clients that value your expertise. We do not want the clients that are seeking to get the cheapest thing possible. You will have, if you set up your practice like that, you will have a difficult life, because you will have difficult clients that are always going to fight you to spend as little as possible. That's not a fun way to be. So this is about knowing what you are worth and being confident in how you communicate your fees. It is also, you need to make sure that, Dana, we've recently had a fuel surcharge since diesel's now $6.60 a gallon. That's great. I just yesterday did a post in our mastermind group saying, okay, who's thought about putting a fuel surcharge on, because the price of fuel in Australia is also really high. And actually there's talk that we might run out. I'm not sure if there's talk about that in the US. I know we're on reserves right now. Fees, okay, knowing what you're worth and being confident in how you communicate this. You do need to know what you're doing to be able to charge appropriately. I would not recommend starting off in dentistry and being twice the price of the people around you. You won't last long. So you do have to know what you're doing. You have to be reasonably good at what you're doing, and there's plenty of ways to improve your knowledge, skills and confidence. I mean, you're here as part of our community now. Obviously, we're going to offer you the online dentistry program that is open right now. But there's also, there is textbooks galore. There is zillions of journal articles. There's conventions, etc. So you are not short on the opportunities to be educated, but you need to find out what works for you. If you're doing up an estimate, include a buffer zone. What else? Yes, you get the clients you deserve. This cuts both ways. If you offer cutthroat prices, you will get cutthroat clients. But if you are charged appropriately and and offer really good service, you'll get the really good clients and they will stay with you. And promos are way, way better than starting with low fees. So some of the things that we have to account for is inflation. Have a think about, are you doing regular fee increases or bulk increases, or are you doing it every couple of years or when you get around to it? Are you doing it every quarter? Take care with shopped items when people are ringing up saying, they want the price of this and they want the price of that. Not to go too hard on those ones. However, when people are calling up, they're saying it's Joe Blogs here, just calling to see how much a dental is. They're not actually really calling to see how much a dental is. They kind of do want to know that, but they're also just sounding you out a bit. Are you easy to talk to? Are you rude? Are you offering them information on the phone? There's a script that we can that we can give you that is like is our dentals include, this and this and this, and you basically will differentiate yourself. Sorry, I'm gonna have a sip of water. Especially from the lay dental practitioners about actually what you offer, and then you tell them the price. So you actually substantiating your price rather than just saying your price. So it's XX dollars. Do you want to book in? Yeah, no thanks. They're going to hang up the phone, or I'll think about it. Hang up the phone. They never call you back ever. Um, Randy's saying, if you don't charge appropriately, you go home feeling ripped off. When new clients ask what I charge, I tell them I am not the best price on aisle 7. That's awesome. Another trick, have a look, and this is I do feel a little bit funny saying this. What sort of lifestyle are your clients living? What sort of cars are they driving in comparison to yours? And then ask yourself, should you be really reducing your fees, or should you be charging what you're worth? It is so common that, I hear this from vets all the time. I have one particular person in mind here. They say, I go to my client's place and they've got a 6-horse gooseneck, and I've got a 20-year-old 2-horse float that I can't afford to upgrade. I'm like, okay, well, let's have a look at your fees. And I can tell you that I've done fee reviews now for over 200 equine veterinary practices from places all around the world, from US, Canada, Finland, Italy, Germany, New Zealand, a ton of us in Australia. We've got the same problems around the world. Fees are too low. We need to be charging appropriately. If I had a magic wand, I would increase fees by 30% for every equine practice in the world all at once. I really would. It would fix so many of our problems. So many of our problems. Anyway, that's my soapbox. I'm not going to go any longer on here because that's not what you guys are here for. Okay, let's advance this one. Missed charges. This is a huge one. Not billing at the time of service. When you do it later, you definitely forget stuff. It does lead to poor record keeping. Who's using AI in their practice now? If you want to let me know in the comments, it's such a golden opportunity here. Are you rushing? Randy, was it you yesterday that was talking about, when we were talking about taking radiographs? We often don't have time to take radiographs. But radiographs are the second most profitable service you can do in equine practice. The first one is dentistry. You're crazy not to take an extra 10 or 20 minutes to do it there at the time and capture that service. And it has all those, beautiful things about increasing the welfare of the horse. It's a win-win for everybody. Not performing cross checks, for example, once a month, having someone in your practice, ideally not you, having someone in your practice look at your lab fees, etc., and then have all these lab fees all billed out. Having a look at your X-ray log, have the X-rays all been charged to a client. So doing a bit of cross-checking there. Not having any systems in place. Charlie's using Covet AI. Yep, Randy's giving a complete breakdown of what is included in a routine dental. Yeah, excellent. How do you distinguish yourself from the vet down the road who's not really kept up their dental skills without sounding arrogant or taking them down? You never ever want to take anybody down. You know yourself, when you go out to a client and they're bad mouthing the previous veterinarian, you know that they're going to bad mouth you at some stage. We never ever want to, excuse me, we never ever want to bad mouth anybody. This is about educating our clients. If you can educate your clients, you're going to be seen as the expert, because often we are, right? Veterinarians are the experts. We have a veterinary degree, anywhere from 5 to 8 years. We are the experts, despite what the lay dentists are saying. They're really good in, kind of digging the dagger in there and saying vets only get a 5-day training course. Yeah, what about 5 years that backs that up? It's ridiculous, but the clients, they see that and they think it's true. Audio takes me a lot longer than 10-20 minutes to take X-ray. Just need lots more practice. Yep, persistent practice makes perfection for sure. And Olivia, hello Olivia, another Olivia is using Talkatoo for records. Yeah, that's an old one, Talkatoo. But I think it's still good, especially with their upgrades. So there's heaps of them. Heidi Health, Heidi AI, Whippet Notes, etc. Just a game changer. So no systems or processes in place like templates, cross-checks, random audits. You might be unfamiliar with an invoicing system. This is especially prevalent if you've got locums in or you're doing locuming. Forgetting to send out entire invoices. Yep, just not getting around to doing it. And then it just forgets because you get busy. It is twice as bad if whatever you are billing for, if the mischarge is a product or a service that costs you money, like antibiotics or lab tests, because not only do you still have to pay your supplier, you're not getting reimbursed from the cost of that by your client, and you're missing out on the profit on top of it. Alyssa's using Scribblevet. Yeah, and Randy's got a tech with you. When you decide to do x-rays, she has yourself in 5 minutes. Yeah, the biggest part of radiographs is setting it up, right? That takes the longest. And also, maybe I should have mentioned this yesterday, you don't have to commit to giving a diagnosis there in the field. I'll often say, oh, I need to import this into a different program. I need to look at it in a dark room on a big screen. Might be the same laptop, but just not out in the sunlight, etc. I might want to send it to somebody to get a second opinion. Don't be pressured into feeling like you've got to give a diagnosis. Maybe just say that's something I want to look at a bit further. So an average veterinarian will forget to charge around 12 to 20% of lab test medications and professional services. This is anywhere from 60, the last statistic I can remember that stuck in my head is $65,000 to $70,000 per veterinarian per year. That is a crap load of money, crap load. This little patient here, this is Lulu. Isn't she just the gorgeous? I am sure that she's got extra vertebrae in there. Look how long she is. She's just the cutest little thing, little stumpy legs, fiercely healthy, fiercely healthy. She's just gorgeous. So the dentistry revenue stack, it's your diagnostics, your exams, your charting, your radiographs. It's corrective dentistry, hooks, ramps, waves, etc. Periodontal treatment, your extractions, your advanced procedures, and I recommend itemizing all of these. So let's have a look. I've been going for an hour now. Let me just check. I've still got a bit to get through. Okay. I'm just going to keep talking, guys. I hope you're enjoying this. I hope you're getting good value out of this. If you need to go, no problem. The replay will be up there, but it's there for you whenever you want. But anyway, I love teaching, so I'm just going to keep going. There was a question about pricing models. Nikita, I think it was you, Nikita from New Zealand. How do people charge for their services? So there's a couple of different ways that you can do it, particularly when it comes to dentistry. So it might be a bundled charge, so an equine performance dental, for etc. It might be charging these out individually. Sedation, your oral examination, your odontoplasty, your malocclusion treatment. It might be a bit of a combination of the two. I am in favour of, or what I used to do in practice is that I would have one charge for sedation and then I would have one charge for the dental treatment, and then which included the oral examination and routine odontoplasty, bit seats, etc. It would not include major malocclusion treatment, very mild stuff that I could do in less than 10 or 20 seconds. I would leave that in there. But for anything else, it would either be a set charge, for example, reducing hooks, waves, or ramps, widening diastemas, relief burrs, treating periodontal disease. I would recommend charging in 10 or 15-minute increments for that, especially if you're pulling out water picks, your K files, etc. You're really spending a very long time cleaning those out. You do need to charge for those, and they can take quite some time. Now with aeroscopy, the owners are likely to be able to see what you are doing, so that they are going to appreciate that. And just talk to your owners about if you've ever had a piece of apple or piece of steak caught in your teeth and you haven't been able to get it out. It doesn't take all that long for it to start being painful. This has been here for some time. I was talking to no, actually it was a different group. Talking to the virtual internship people group on Monday when we were doing one of our sessions. Educating clients about periodontal disease is having the getting the impacted feed and getting the owners to smell it, because it smells foul, right? It's that really anaerobic smell. You will know by the look on your client's face if they've really smelt it or if they're just pretending to smell it to, be polite, because it's a totally different facial expression. But again, it's part of the education. If they understand what you're talking about, they're going to be saying yes to treatment in vast majority of the cases. So your sedation, how do you charge that? So one way is not better than the other. They are all good ways if you implement them appropriately. You can charge sedation by volume, by levels, or by number of doses. It doesn't really matter. My preferential one is by volume. I have an injection fee on each of them. So it would be, ACE and ditomidine and butorphanol as my standard cocktail, and that would just be a charge for each of them. You could also do sedation, mild, moderate, deep, or level 1, level 2, level 3. You could do it out by sedation first shot, sedation second shot, something like that. Maybe think of a better name than shot. Let's have a look. Kristen, anyone using a cheaper option for a Roscoe plumber's camera? They're called boroscopes. Yeah, look, I'm sure people are using them. Then they're a world apart from the actual oroscopes right now. But if you're just starting out, you could certainly give it a go. It just gives you a tiny field of vision, and it's also a 0-degree angle, which is no good. Randy's saying he's tried them, just need to get one with 90. So 90 is no good either, because you don't want to be looking directly down on the tooth. It's good for doing surgery if you're just focusing on one tooth. However, you really need a 70-degree camera. You can get a 30-degree pretty cheaply online, but they're so good these days. I think, if you're just starting out, sure, use those. But if you're really into dentistry and you've already educated yourself, then have a look at investing with the oroscope. But again, you've got to know what you're looking at, right? And they're easy to break, so you've got to be careful with those. If your fees are all they complain about, they have nothing to complain about. Oh my goodness, I love that. That's awesome. That's great. Thanks. I'm gonna take that one. Audrey's saying the flexible ones aren't too bad, but they're hard to maneuver. Yeah. And our flexible endoscopes, if you're talking about like an equine endoscope, not a boroscope, one crunch and they're dead. So just be really careful about that. Okay, pricing models. How are you guys pricing for your dentistry, your perio, and your extractions? So I'm not going to tell you how to price these. These are going to be very much individually dependent. But the options you have are to charge per series, and that's what I would do. That's my personal, I'm not going to tell you what to do, but I can tell you what I have done is I charge per series. So I'll have a dental series, and it just allows me to take as many radiographs as I want without me feeling the owner was there sweating every time I pressed the button because it was going to increase their bill. You could charge a setup fee plus a per view fee. Intraoperative radiographs are a massive thing, because if you're doing surgery and you're getting complications, you need to know where you're up to. And then post-op radiographs as well. I don't mind charging less for post-op radiographs, and they are separate from the dental series. And I've never had pushback on charging for that. Your periodontal treatment, so you could, a couple of different ways here. You could have a single charge, for example, water pick using forceps or it's supposed to say endophiles, and other sorts of things. You could just have a single blanket charge. You could charge per 5, 10, or 15 minutes, or you can charge by levels, level 1, level 2, level 3. I am a big fan by charging by levels for both perio treatments and for extractions if you're in equine practice. Not that we're trying to hide anything at all, but it allows us to kind of categorize our whatever we're doing, into basically it's easy, moderate, or difficult. I think it's all swings and roundabouts. You win some, you lose some. But putting them into the levels, I think, is a very valid way to categorize these. What we really don't want to do is that we don't want to nickel and dime. I've got all the analogies here. We don't want to nickel and dime our clients. We don't want to be putting on 50 things, line items. Like, yes, we want them to be itemized, but we don't want anything. I'll often recommend we don't want any charge under $7 in there. So if you're charging out, not dentistry, but for example, IV fluid setup, if you're charging out your, catheters and your bungs and your giving sets and your tape and your suture and all that sort of thing, just have them in a bundled charge. Don't charge everything all individually out there. Yeah, so for your exodontia, when I was in practice, in general practice, I would charge out my sedation, my exodontia bundled charge, and then my radiographs and then drugs and any other medications as well. For things that you could look at charging individually, drugs, consumables, your surgery time. I did see a comment in, I think it was the Equine Vet to Vet Facebook page about what should I charge for this, and someone commented 200, what the time it takes you, it's $200 an hour. I'm like, $200 an hour? That was like 20 years ago. Vets were $200 an hour. For surgery, it's more like $400 to $450 an hour. That is both in Australian dollars and American dollars. So they're very, country dependent, but the same thing goes for either country. And if you're in other countries, you'll just have to extrapolate for that. Yeah, so your surgery time really should be booked out at $400 to $450 an hour, and for your general equine practice, that's more like $350 to $400 an hour. So if you are not earning that or billing out that sort of money in your practice, we can certainly help you with that to fix that in something like the mastermind. But today we're specifically talking about our dentistry. So our radiographs, of course, you can't take your horse to the general store to get radiographs. You can't just walk up and press a button on a computer and it's going to spit out x-rays like, well, an owner can't, right? It's not like going to the ATM or a library where you can just check it out of the library. It's definitely something that you need an expert to not only take it, but also interpret it. Nursing and care and facility fee and other procedures, nerve blocks, etc. If you're ever worried about charging for your nerve blocks, no problem. Don't charge for it. Just give the needles, syringes, catheters, whatever to your client and get your client to do it. No way known. They don't have the expertise. It's really scary for them. Don't be afraid to charge for your professional time. You are the expert in this. Well, this is an interesting one. This is a paper published in 2013 by Black. Or Blash, I think it is. So they did a study on the cost of resedation specifically when we're talking about equine dentistry. And they looked at the resedation rate for 10 participating veterinarians over about 363 cases. And it did range from 2.5% to 73.5%. And the mean overall resedation rate was 27%. And the sedation failure, so which means you need to go and then resedate them, did reduce the hourly billing rate by 14%. That's $40. So $40 an hour. And you're doing I'm not very good at maths. I love accounting. I'm not very good at maths. So instead of working a 6-hour day or an 8-hour day, I'm going to do a 10-hour day because I can times by 10. But if you are having sedation failure, that is $400 you are losing in a day. And that's pure profit that you're giving away, you're losing. So it did also increase the completion time by 5.5 minutes. So if you are seeing 6, 8, 10 cases a day, that's 10 cases a day, that's 55 minutes. If I've got the maths right there, that's an hour extra every day that you're going to have to work. So the takeaway for that is to carefully go a little bit harder with your sedation. The biggest problem I see with vets learning to do dentistry is under-sedating or over-sedating. More commonly, it's under-sedating and they're fighting the horses and they end up hating it and they walk away from dentistry. Don't be that person. It's not that hard. You just have to find that sweet spot for you. And again, it's all about education. How much do I charge for nerve blocks? Gosh, I'd have to go and look it up. How much do I charge? I'm probably more comfortable with what I recommend people charge, because I actually don't charge in referral practice. It's part of a bundled fee. But when I was in equine practice, or what I would recommend now is minimum of $65 minimum. That's Australian and US. And if you are doing, for example, the caudal maxillary nerve block, that's more like $145. It's a sterile nerve block. You're wearing gloves, etc. And similarly for the um, uh, inferior alveolar nerve block or mandibular nerve block, the cost of your consumables are higher there. You know, you've got a spinal needle or a 15 gauge, what gauge is it? 14 gauge, 5 3/4 inch catheter to administer that. You're needing a new bottle of local anaesthetic, so definitely do charge a bit higher for that. I'm not going to get you guys to comment how much you charge in this because the regulatory authorities take a very dim view on us discussing um, discussing our fees. They're worried about price fixing, so I'm not going to get you to comment on this in this sort of forum. But I'm happy to tell you what I recommend that I charge clients. Discounting. Oh, this is one of my favorite things to talk about, not to do. So discounting, it's awful. You are going to educate your clients to expect a discount. You offer it once and they'll expect it again the next time. It really does devalue your services and it is rarely appreciated by your clients. So one way to think about this is that every time and look, I know that there's always going to be cases that are, welfare cases or, bleeding hearts or something like that. And look, I totally get that. One way I do like to think about this is that if you are considering discounting, say you're going to discount a bill by $100, I want you to think about reaching your hand in your pocket, taking out your wallet and handing your client $100 and say, thank you very much. I really enjoyed working on your horse today. It's the same thing. You are literally doing the same thing. It's just because when you delete it from the invoice, that transaction doesn't happen. It's the same as you giving them $100. So don't shoot yourself in the foot. If you, so for example, if you're a practice owner, and you can even do this if you're the associate, talk to your practice owners about this, is have a set amount. This works so well. For example, if you've got an associate that is a chronic discounter, have a set amount that each veterinarian can provide in discounts every year, and that's a yearly amount, $2,000, $3,000, whatever it is, $5,000. And that can be an angel fund, but once that's gone, once it's all been used up, it's gone and it doesn't replenish again to the next year. And it does make people think about who actually really deserves this and who am I just giving this to because I don't feel valuable enough to charge that, or whatever the situation. That's an absolute game changer if you are the one who's chronically discounting or if you have an associate that's chronically discounting. In our mastermind groups, occasionally we do need to implement a little bit of an accountability thing here that people that really struggle with discounting is that we set up this arrangement that every time they discount, they have to tell the mastermind group that they've done it. And I can tell you what, that drops the frequency of discounts hugely. So be accountable for that. And yeah, set aside some time to form genuine vet work on a pro bono basis. So for free, this is genuine charity based vet work because that's important to me. It's important to a lot of people. So if you're worried about affecting animal welfare if you don't provide discounts, the animals will suffer. Go and do it specifically for free, but just don't discount. Jacqueline, discounts, open your wallet and give the client cash. Discounts equals vacation, riding lessons, morning coffee. Yeah, so bartering system. Yep, you can definitely do that. If you're a practice owner, no worries. If you're an associate, you're going to have to run that by your practice owner. That would be frowned on, I think. But Jacqueline, I know you're a practice owner, so yeah. Okay. Oh, we're getting to the end now. So I wanted to just finish this off with giving you a little bit of an example on the 3 ways to grow your practice. So seeing more clients, increasing the frequency and increasing the value of each transaction. So I've already admitted to you guys I'm terrible at maths and I can't do maths to save myself. So I'm going to work in round numbers here. And I like this one because I've got the spreadsheet already done the maths for me. So if you're looking at a practice, and I've just picked a random number here. So Mary is in solo vet practice working 5 days a week. She's billing 400,000, which is, probably about the average level. I've seen solo practices do way more than that. Her COGS, which is the cost of goods sold, in a nutshell, if you haven't been exposed to this before, this is going to be your drugs, your medications, your labs, the cost of your imaging, little bit of waste disposal, but that's generally it. And then your operating expenses, which is your overheads, your car, your fuel, your vet software, your uniforms, like advertising, everything else falls into that bucket. If the cost of your goods sold is at $80,000 a year, so that's 20%, which is where most practices really should be. That's definitely achievable. And your operating expenses are 70%, you're going to be left with $40,000 after paying all your bills and taking a wage of about 10%. This is a reasonable vet practice. Unfortunately, I am in the situation of seeing heaps of practices that their profitability is way lower than that. The good news is that if you know what to do, it's not difficult to fix that. If you increase your revenue by 10%, so that then brings your revenue up to 440,000. The cost of the goods sold is going to stay the same. So it's still 80,000. Your operating expenses is going to stay the same at 28,000, but your percentages will change. So your COGS is reduced to 18%, your operating expenses is reduced to 64%. The good news is that profit falls straight to the bottom line. The increase in revenue falls straight to the bottom line. So your profit is then 80,000 or 18%. So you've just gone from 10% to 80% profitability by increasing your revenue by 10%, doing all of those things that we were talking about in there. At the same time, if you also decrease your operating expenses, so we're going to drop our operating expenses to 240,000, but we're not going to increase our revenue, then we've still got that $80,000 revenue, right? So that's then take us up to 20% profitability. If we do both of these together, we increase our revenue by 10% and we decrease our operating expenses by 10%. Have a look at those figures. So we're billing out 440,000. Our COGS, our drugs and medications, etc., exactly the same, still 80,000. We've reduced our operating expenses, so that's now 240,000. Our profit jumps. We've gone from 40% profit, way over on the left-hand side, to 120,000 profit on the right-hand side by doing those two things. So I just wanted to bring this in here because majority of practices are really busy running around servicing their clients and just basically getting along in life. But if you really have a look at this, you can increase the profitability of your practices dramatically. One of the best ways to do this is with dentistry. And for those of you who are already in our dentistry, our online training program, or are thinking about joining us, we do have something in there so that if you sign up to the platinum package, which honestly, that's where the majority of people go and it's where you get the most bang for your buck. It also gives you the opportunity to have a one-on-one with me, and I'm going to help you set your prices for your dentistry. This is absolute gold. I can show you a formula that I use that's going to show you how to get an even quicker return on your investment, even more than what I talked about with doing that client education night. We're also going to help you go through your equipment and work out what you need, and more importantly, what you don't need. A lot of practices waste good money buying equipment that's really not suited for them. So don't fall into that trap there. Okay, you already have the clients and you already have the opportunities in your practice. A lot of the stuff that I've talked about here is not hard. If you remember nothing else from today, it's educating your clients. That's where educating yourself and educating your clients, that's where you're going to get the most bang for your buck. About looking for the gold that is in your practice. It's already there. So we want to definitely shift away from just checking teeth and doing dentistry to delivering really good, high quality care for our patients. And please stop giving your expertise away. We need to bill for what we are worth. We have, $250,000 worth of education in our head from vet school. Many of you here, and it tends to be the people that are really invested in their education and part of our community. You are investing money on making yourself better, which in turn means that you do a better job looking after your clients. And it's a freaking fantastic feeling when you're learning new things and you're applying it and you're seeing the horses get better. Like there's no better feeling. I love it. So yeah, I think that is about it. So feel free to ask any questions, guys. I know that there's a lag in Facebook, so we'll give you a moment here. This, oh gosh, this is one of my most favorite holidays ever. This was a photo of Cradle Mountain National Park down in Tasmania when I did the overland track. It was 6 days, no Wi-Fi. We did do it in style. We didn't camp, we stayed in lodges. It was incredible. No phone service, beautiful, beautiful scenery in Cradle Mountain. It's one of the World Heritage Areas. If you ever do get to Australia, highly recommend going there if you're into hiking at all. Absolutely wonderful, wonderful thing to do. And if you run a successful equine practice, you do all the things we're talking about, you're also going to have the funds to be able to go and spend money on stuff like this and take the time off and have beautiful holidays too. So anyway, that's just my little pitch for a bit of work-life balance. Okay, Audrey is saying, I've not really tried it very much, but you can give diazepam or midazolam to stabilize the tongue. It can make them more ataxic. Yep, very, very true. I'm not a massive fan. I will use it sparingly. I have had a case that went terribly wrong. Horse died under my care when I was using diazepam, but that was really, it was a very, very long time ago now when I was first starting out with dentistry, and I wasn't doing the right thing. I was using far too many drugs, not doing nerve blocks. I'm not doing nerve blocks appropriately. Yeah, and I always feel horrible when I think about that case because that was totally my fault. But in the right hands, it can work really well. It will give you about 10 minutes of total tongue stillness. Okie doke. Right. Feel free to ask questions. We've still got a heap of people. You guys have stayed. Thank you so much. I do appreciate that. And that's the end there. Let's stop sharing.